Hi guys, I'm going to be starting a new treatment for MS, so I'm going to keep a video diary, hopefully weekly, and update it to YouTube, so hopefully everyone can have a look and see how I'm going and see what happens. But first of all, I'll tell you about what the differences are and what the treatment is. So basically I researched and looked to find different treatments for MS because all the treatments that are out there at the moment are just to maintain the disease where it is and hopefully prevent further deterioration. There's nothing that actually tries to get the disease. It's all about, oh, you've got MS, that sucks, here, have some disease modifying stuff, but sorry, you can't get better. Now, I refuse to believe that in our day and age we can't at least find out what is doing this. And so I had a look around because I really do believe that the answer's out there. People have found it. I think they're just not all communicating with each other and coming up with the answer and realising that that's what it is. Anyway, what I have found is a treatment called Combined Antibiotic Protocol. Now, this all started about 10 years ago, 2004 I think it was, in the UK, where David Weldon came up with this protocol for his wife Sarah, who was very, very ill. She was, I can't remember if she had secondary progressive or relapsing remitting, but she was very ill, and they wanted to put her in a nursing home, and he basically said no and came up with this combined protocol. Now, Sarah was about to be put in a nursing home. She was that disabled, and yet today she is back painting. She is doing her artistry stuff. She's basically a normal person. And there are other stories as well, but that one's obviously the first and one of the best. Now, there is only one doctor in Australia that I can find that does this protocol. He's Dr. Paul Thibault, which is spelled Thibault. So I call him Dr. Paul. Anyway, he's in Newcastle, and he has currently about 50 MS patients, and most of them are doing quite well on this treatment. It's a very, very difficult treatment for the person taking it. But anyway, I'm getting ahead of myself. It's what we're actually treating for is antibiotics to treat persistent Chlamydia pneumoniae, which might be the underlying cause of MS. We don't know. But what the thinking is that this bug actually goes inside your cells, which is why you can't find it floating in the bloodstream. And so to kill it, we need to stop it spreading. We need to get it inside or outside of the spell of the cells. So we people going on this treatment take 2 lots of antibiotics. I've forgotten what they're called. I'll let you know because I know there are medical people out there who would like to know. And I have some notes here somewhere. I think it's over here. So the antibiotics we take are minocycline twice daily, and then when that's tolerated quite well, you take roxithromycin, roxithromycin. So you basically take the first one for a month, and then you at the same time take N-acetylcysteine, and then after a month you take roxithromycin. Now, those two together basically are supposed to stop the bugs from spreading. And then you take another antibiotic once or every 5 days, or for 5 days, once a month. So that's called pulsing when you do it like that. So what you do is you take tinidazole or something like that, and you just continually pulse. And what this does is kills the bugs in the cells where they are. But the reason you pulse it is because when you start taking this, it kills the bugs, and when the bugs die, they let out a toxin, and the toxin gives a very similar effect to when we first had our MS relapses, and so we actually get as sick as we were then. And this is why you only do it for a few days at a time, because your body can't actually clean it all up all at once. So it takes a long time, and you just pulse. But the thing is if you get really sick when you're taking this third antibiotic, if all your symptoms flare, it's working. So I'm actually looking forward to getting worse, because it means it's going to work. And of course, if it doesn't work, that's fine too. We'll go back to using Copaxone and all of that stuff. But what I've decided to do now is now that I've explained what I'm going to do, I'm starting next week sometime, I hope. I'm just going to make a list, tell you all of the symptoms that I generally have from MS. Now, the biggest and worst is chronic fatigue. Everyone knows what that is, I'm sure. I just suffer massive fatigue a huge amount of the time, and it's very, very hard to manage. I also have tinnitus, the ringing in the ears. I'm nearly always hearing, I guess you could call it white noise. It's really bad at night, obviously, when everything goes quiet. I have hypersensitivity, particularly in the leg muscles, and also the groin and the nipples. My eyesight is deteriorating very fast, so much so that my optometrist continually sends me for diabetes checks, because he's worried I've got diabetes because my eyesight deteriorates so fast. And I tell him, gee, I'm sorry, I have MS, but he still sends me for diabetes checks, which I don't have. What else? Sexual dysfunction, complete loss of sex drive. And my eyesight, on top of deteriorating very fast, it's also generally very blurry in the morning. Someone once described it as having a net over your eyes, and then someone very carefully wiping it with Vaseline, which is almost exactly what it's like. My personality has changed. I've lost my sense of whimsy and my sense of play. I have a major lack of energy. I've lost all my drive and determination, which for me is, it changes who I am radically. I frequently suffer balance issues, which I occasionally, under protest, use a cane to counter. My left leg is much weaker than my right. I have muscle spasms in my legs, which some people call restless leg syndrome, but this is an MS one. I have occasional urinary incontinence, very occasional bowel incontinence. I have flushes, major reactions to insect bites. I get itchy. I get itchy all over. Oh, it's horrible. So I, can frequently be seen rubbing my back against a wall, and poor Brad has to scratch me a lot because it's really bad. I have word fishing and brain fog. Word fishing is really quite bad. If you don't know what that is, it's where you know what the word is but you can't find it, and so there's this pause while you look for the word that you are searching for. One of my friends with MS has it so bad she actually carries a whiteboard with her, and she draws pictures of the things. So I'm glad I'm not that bad. And another one was telling me she was at the supermarket and talking to the lady there, and she was sort of saying my thing isn't working. You know, the big white thing that you put cold stuff in is really, I mean, this is what MS does to us. So I get tingling in my left arm and hand. I have very cold hands and feet. I have numb feet. And there are other things as well, but those are the ones that were easy to pick up. So I've decided to go ahead with this treatment. I am very hopeful that it will have some effect, at very least halt MS. I mean, obviously I hope for a cure. Everyone hopes for a cure. But that's just my hope. I don't really have any expectation. But I'd like to stop the progress of the disease, and I'm hoping that this will do it. So that's about it. I have to take those 3 medications that I mentioned, also the NAC. Obviously, I also need to take quite a few supplements. So I'll be taking vitamin B12 because people with MS are low in vitamin B12. I'll be taking vitamin D because people with MS are low in vitamin D. And I am personally, I've had these tested, and I only had to start taking vitamin B12 about 5-6 months ago. I also take fish oils. I also have reflux, which is actually really bad. It's really, really painful. You know, like the bottom of my esophagus feels permanently burnt. So I take Nexium for that, which most people will say that's got nothing to do with MS, but I didn't have this until I got MS, and it started out by me not being able to actually swallow. The back of my throat felt like it had gone hard and I couldn't physically swallow. And a nose, ears and throat specialist told me that that can be a reaction from having reflux. And so he put me on the Nexium, and it works. And if I go 2 days without Nexium, I'm in a lot of pain again, so that's great. My other medications that I take for MS are baclofen, which is a muscle relaxant. It stops the spasming, and also Endep to help me sleep, and that's a pain thing as well, I believe. And those 2 are probably the only ones besides Copaxone that are actually full-on MS medications. I have high blood pressure, which I never had in my life before. Only since I've been since I've been an MS patient. I'm now about 2 stone lighter than I was 6 months ago, and I had been that weight for maybe 2 years, and I hadn't had high blood pressure for quite some time. And then, you know, a year or so ago, boom, high blood pressure. So there wasn't a lot of change in my life. Don't know why I got it, but I think that's all the medications that I take. So I'm going to stop a lot of those, I hope, if things improve, but for the time being I'm going to stay on all those medications except Copaxone, which I stopped about 2 weeks ago. I had a really bad injection reaction, and I had an open wound in my leg about, I don't know, 10 centimetres across. And yeah, I just don't want to do that anymore. So I'll let you all know how it goes, which is the whole point of this. And please, I'm going to put some links under this so that you can see the places that I'm talking about and have a look at what the protocol is if you're interested. And if not, any questions, I'd love to answer some and feel that I'm connecting with you people. That would be really nice. And I'll catch you all next week when I start, probably a bit more than a week, about 10 days, when I actually start taking the new drugs. So I'll see you all then.